We picture historical asylums as haunted, decaying places. But to understand why we tore them down, we must first understand why we built them. In the early 1800s, there were no dedicated hospitals for the mentally ill. If someone suffered from a severe psychiatric condition, they were often thrown into local jails or windowless poorhouses, locked away alongside criminals in a system focused purely on punishment. That changed with a movement called moral treatment. Reformers like Dorothea Dix argued that the mentally ill were patients who needed specialized medical care, not inmates deserving of shackles. They advocated for compassionate sanctuaries designed to heal. This compassion dictated the architecture. Under the Kirkbride Plan, states constructed sprawling, grand public hospitals. The design itself, featuring abundant sunlight, fresh air, and structured daily routines, was intended to serve as a curative medical instrument. At the time, the rise of the American mental asylum was seen as a humanitarian triumph. It was a progressive movement that rescued hundreds of thousands of people from squalor and neglect. Over the next century, that vision collapsed. Rapid population growth across the country, combined with the catastrophic economic drain of the Great Depression, overwhelmed the financial and spatial capacity of the state hospital system. This chart tracks the population of public psychiatric hospitals. By 1955, the number of institutionalized individuals had grown by over 1,000%, reaching a peak of nearly 560,000 patients. Individualized therapy became impossible. The buildings designed as sanctuaries devolved into mass custodial warehouses, plagued by overcrowding, understaffing, and severe neglect. The asylum system had failed its own medical mandate. This humanitarian crisis pushed public outrage to a breaking point, priming the political pendulum for a massive swing in the opposite direction. In the 1950s, two distinct breakthroughs provided the tools to dismantle the system. The first was medical. The introduction of Thorazine in 1954 provided a pharmacological way to manage severe symptoms, suggesting that patients could be managed without locked wards. The second breakthrough was sociological. Academics like Irving Goffman argued that the rigid, bureaucratic control of the hospital, the total institution, was actually stripping away patients' identities and causing further trauma. Through this lens, the hospital building was no longer seen as the cure. It was viewed as the primary cause of the patient's disability. In 1963, President John F. Kennedy signed the Community Mental Health Act, signaling the official start of deinstitutionalization. The goal was to cut the asylum population in half by moving care from isolated state facilities into a network of localized community centers. The vision relied on comprehensive support. Discharged patients would receive outpatient therapy, local housing, and the chance for social integration in their own neighborhoods. The intent was never to abandon the mentally ill. Deinstitutionalization was a promise to liberate patients into a supportive society. But the execution failed. Policies closed hospitals, assuming thousands of local centers were waiting. As federal funding evaporated, most were never built. The few surviving centers shifted focus away from severe psychosis, choosing to treat mild stress instead. Patients with serious mental illness were liberated from the institution, only to find absolutely no receiving arms in their community. The policy created an institutional vacuum. We successfully dismantled the old safety net, but failed to weave a new one. This led to trans-institutionalization. Without medical support or housing, hundreds of thousands of severely mentally ill individuals were eventually swept off the streets and absorbed into the criminal justice system. Today, the largest mental health provider in the United States is not a hospital. It is the Los Angeles County Jail. The second and third largest providers follow the exact same pattern: Cook County Jail in Chicago and Rikers Island in New York. Tearing down an abusive system is only half the battle. If society fails to fully fund a functional replacement, the original problem doesn't disappear. It simply takes a new, darker form.